Our update today is going to cover where we are so far in the legislative session here in Arizona, as well as a few things that are happening in Congress. I want to be clear, there is no way we could possibly cover everything that's going on, especially at the federal level, but we'll try to hit some of the high points. And if you have questions afterward, if you have questions during the presentation, we hope you'll ask them. I am always happy to talk with people at length about things that either don't get discussed fully in this presentation, or things that don't get discussed at all, but that you have questions about. I may not know the answer to everything, but between myself and Sarah and the rest of our staff, we can usually point you in the right direction. So don't be shy about contacting us if you have questions. First of all, I want to remind everybody what the Arizona Developmental Disabilities Planning Council is. We are a federally funded agency. For administrative convenience, we are located within the Department of Economic Security here in Arizona, but we are not a part of DES. We do not answer to DES or to DDD or to Access or any other state agency. We answer to the governor's office and to our council members, who are all appointed by the governor. Because of our federally funded status, we are not lobbyists. We do not take positions on legislation or on candidates. I don't think it's going to come as a surprise to anybody that our feelings about certain bills are probably pretty clear, especially bills that would harm individuals with disabilities. But we do not formally take a stance on the legislation. We do not testify for or against bills at the legislature, but we do a lot of education work. And in fact, our job is to be advocates for people with IDD and to educate the communities around the state of Arizona, and that includes our elected officials and our unelected policymakers, on issues that affect people with disabilities in the interest of systems change. We are one of 56 councils around the country in every U.S. state and territory, and our funding comes through the Department of Human Services and specifically through the Administration for Community Living at the U.S. Department of Health and Human Services. Also, as a reminder, and these are some things, if you attended our session back in January, some of this is going to seem pretty familiar, and that's because it is in many cases a repeat of what we were talking about then. But I do think it's important to sort of set the stage. As a reminder of where we are in the second year of the current legislative session. All of our legislative sessions in Arizona are 2 years. The legislature meets every year, but the legislators themselves are elected or re-elected every 2 years. We're now in the second year of our current legislature. The Republicans do control both houses or both chambers of the legislature, the House of Representatives and the Senate. Their margins are 17-13 in the Senate, 33-27 in the House. I also would point out that this year there were some key leadership changes. We also talked about that back in January. Jon Kavanaugh, who had been the Senate Appropriations Chair, is now the Senate Majority Leader, and he has been replaced. David Farnsworth is now the Senate Appropriations Chair. There were some other committee assignment changes and some committee leadership changes. I won't get into all of those, but it is important to note that Jon Kavanaugh, who has long been sort of the go-to guy in the Senate when it came to anything around appropriations, he's now in a different position. And David Farnsworth, who has a long history as a legislator himself, is now in that chair. And that matters because appropriations in both the House and the Senate those are perhaps the most powerful committees because they control the checkbook. They control what gets presented to the governor in the way of budget proposals, and the budgets are always negotiated between the legislature and the governor's office. But what comes from those appropriations committees to the governor is at least the starting point for what the state government is going to spend on services, on programs, on everything the government spends money on in any given year. At the congressional level, this year, the margins are a little closer than they have been in recent years because of some folks who left their seats. Marjorie Taylor Greene is one of those folks who resigned. She was a MAGA stalwart for those who follow federal politics, but she left at the beginning of this year, resigned her seat. There were a couple of deaths. One Republican, one Democrat died during the course of this current legislative session, and they have not been replaced. All the two resignations and two deaths will not formally be replaced until the election this coming fall, which means that currently in the Senate, there's a 53-47 split. The Republicans are in the majority, and in the House, there's a 218-213 split with the Republicans in the majority. But these are important because, first of all, in the Senate, most bills require 60 votes in order to pass. Not all, but most require 60 votes. And that means you can't, with a margin like this, you can't get anything passed unless you get cooperation from both parties. In the House, it requires, 216 votes to get a bill passed. And that means that if more than 2 Republicans decide they don't support a particular bill, a bill can be doomed in the House. And so again, it often requires collaboration between the two parties in order to get things done, or it requires in the House that all Republicans get in line with a particular issue and push that forward. And we've seen some issues lately where that hasn't been the case, where the members of the particular parties have not entirely aligned. And then, of course, if you follow the political landscape at all, you know that this administration is very much an activist administration, the presidential administration, and you know that President Trump has an agenda, as well as those who serve him. So they have been making a lot of moves which have not necessarily received congressional approval. They haven't necessarily sought congressional approval when they've been making those moves. So it has created some tensions. It has created some adverse consequences, we might say. But there are certainly folks who think that's within the president's right it's within the president's right to act the way he does, and it's within the administration's right to take on certain things and proceed in certain directions that others might not in the past have seen as appropriate. So, also, I mentioned this is an election year. 2026 is an election year. All of the seats in the legislature in Arizona are up for grabs. There are a lot of districts that are considered safe districts. There are a lot of districts where, at a minimum, the party holding the seat is not going to change. In many cases, the person holding the seat is not going to change. But there are more and more districts in Arizona that are sort of contended, let's say. They are not as safe for one party or the other as they perhaps have been in the past. And that makes for some interesting races. In addition, all of the statewide offices are up for election this year. That's everything from the governor's office to the secretary of state, the attorney general, the treasurer, superintendent of public instruction. And that's a very interesting battle because the current treasurer, Kimberly Yee, is running against the current superintendent of public instruction, Tom Horn. They are both in the same party. They are both Republicans, but there is a battle over that seat coming up this fall. And then, you know, mine inspectors and various other statewide offices, those are also thrown into the mix this year. At the federal level, just as is the case with the Arizona legislature, all House seats are voted on every 2 years. In Arizona, as you may know, we have 3 Democrats and 6 Republicans representing the congressional districts in the state. And we have 2 senators who are both Democrats at the current time. 33 of those regular Senate seats are up for election this year, including the seat held by Mark Kelly from Arizona. And then there are the 2 partial Senate terms that were vacated when Marco Rubio and J.D. Vance left to serve in the current administration. Those, a seat from Florida and a seat from Ohio, those need to be filled through the election this fall. So that's just kind of a snapshot of where things stand with regard to the elections. What are the key disability issues that are affecting the state of Arizona right now? Again, we talked about this at our last presentation, and these really tend not to change a whole lot from year to year. At least they haven't in recent years. Funding. There's no question that funding sustainability of the system is first and foremost on people's minds. We know there are a lot of different factors involved in this, and we just know that money is essential in order to make the DD service system operate. It's a fact of life. And so we don't like to think that everything boils down to money. Certainly, you know, people's commitment and people's advocacy matters, but money is absolutely fundamental. Without funding, the DD service system could not and would not exist. To that point, we're now looking at a situation where federal support is going to diminish over the next who knows how many years. The passage of H.R. 1, some called it, and this is the only time I will call it this, the One Big Beautiful Bill Act, that passed last summer, and that mandated up to $1 trillion in cuts to the Medicaid system over the next 10 years. That's going to have an impact. $1 trillion is not pocket change. And so it's going to affect our system here in Arizona. It's going to affect systems across the country. There are also issues about whether the DD service network in Arizona is adequate to the need. That's the provider network primarily, but also healthcare providers. I mean, not just service providers, but healthcare providers, but a whole range of different folks who serve people with disabilities. In some pockets of the state, it's very difficult to get the services that people are eligible for. And so that becomes a major issue, and it may simply become worse as less funding is available for those services. Then there's education, and I will talk a little bit more about education when I get to the federal section, but certainly special education for students with disabilities is a hot button issue. Some of it has to do with ESAs, some of the employment scholarship accounts, for those who aren't familiar with ESAs. Some of it has to do with just special education in the K-12 public education system. And then there are issues around transition and employment, trying to boost the numbers of individuals with disabilities who are employed in Arizona, trying to create more employment opportunities for them, and to make sure that they're prepared for employment as they come out of the education system. And then there are issues of voting rights. And the voting rights issue transcends the disability community. This is an issue for a variety of reasons that could affect everyone in the United States. Some of it at the federal level, some of it at the state level, but voting rights are, I would say, under attack right now. And I take that for what it's worth, but there are a number of attempts to address the ability of people to cast their ballots and to make it more difficult for many people to cast their ballots. We think that's a danger. At the federal level, again, funding. Federal budget cuts as a result of H.R. 1 are going to touch on a wide variety of different areas, none more so than Medicaid. Medicaid is the funding source for our DD services in Arizona as well as elsewhere. But then there's education and some proposals not only to cut funding for education, but to cut the Department of Education. Then there's healthcare coverage. We are probably all familiar with what's happening with the Affordable Care Act and the challenges around that, which I will also touch on when I get to the federal portion. Changes in services of the Department of Health and Human Services, part of it around vaccines, part of it around nutrition, part of it around a whole variety of other things. But that is going to have an impact on Americans, whether they have disabilities or not. Then there's the issue of what's being termed waste, fraud, and abuse. And I'll talk about that more when we get to the federal portion, but that is a phrase that's being thrown around a lot. There are some folks who believe there is a tremendous amount of waste, fraud, or abuse in particularly in safety net programs like Medicaid and Medicare. There are others who feel that's overblown. And then there are various other initiatives, including immigration, that are weighing on the disability community in a variety of different ways. We'll talk a little bit more about them, but those are sort of the top line issues that we're looking at in the council community, and I think in the broader disability community as well. So at the state level here in Arizona, the conversation really is being driven by these things. And this is really the funding conversation. First of all, the Parents as Paid Caregivers program. It is a relatively new program in Arizona. We've long had a program that allowed parents of adult All-Tex members to provide care for them, debilitation, attendant care, a few other things. But just recently, in the past few years, we instituted a Parents as Paid Caregivers program for minor age members, and that has been very controversial. If you paid attention to the last legislative session, the 2025 legislative session, you know that it was really the fundamental issue that created such consternation around funding the DD system and the shortfall in funding for the Division of Developmental Disabilities last year. It has taken a lot of heat, not entirely deserved. The program has been a godsend for a lot of folks. It isn't without its issues, and we could debate all day about how and when and where, and just the things that could have been done differently about the program. But the fact is, especially during the pandemic and afterward, when we have faced the continuing shortage of direct support professionals, it has filled a gap for a lot of families who would have gone without services. Was it perfect? No. Could things be done better? Probably. And in fact, that's one of the things that the state is working on right now. But that was seen as really the primary villain last year. But there are also other factors around funding for the system and the costs of the system. One is caseload growth. People continue to move to Arizona. People continue to be born in Arizona. We're seeing larger numbers of people with disabilities who need the services the system provides and who are eligible for those services. So the caseloads are growing. In addition, more people are using the hours and the services that they're made eligible for, and so utilization is growing. There's also the fact that everything simply costs more now. The cost of doing business for providers, for the division, for the state, for the private sector, everybody's costs are going up, and with minimum wage increases taking place every single year on January 1st, as mandated by law, as passed by Arizona voters a few years ago, we are seeing the costs just increasing and increasing and increasing. And unfortunately, for providers, the reimbursement rates have not gone up to keep up with those increasing costs. Providers have not seen a real rate increase in about 7 years. And that means that as their costs of doing business go up, they're having to do more with less. Then, of course, again, the federal government plays into this because federal government policies support all of our DD services here in Arizona, and the federal government pays more than anyone else for the services. We currently have, roughly speaking, a 2-to-1 match formula here in Arizona, which means that for our Medicaid services, the state pays about 1/3, and the federal government pays about 2/3. It's not true across the board, but that's roughly speaking how it works in Arizona. So if the federal government decides to reduce the portion it's going to pay, that means the state has to make up the difference. And so, our state budget is currently very tight. Some years it's good, some years it's not as good. It's very tight right now. And so is the state going to have the money to make up for that difference? It is very much an open question. And there is really no answer yet. Right now, there hasn't been a lot related to the disability community. There hasn't been a whole lot related to funding of DD services into the coming year as part of the discussions at the legislature in 2026. We do know, and if you are participating in the Parents as Paid Caregivers program, you know that a weekly service hour cap was implemented last fall. There is a maximum of 40 hours per member per week in what can be provided through the Parents as Paid Caregivers program. That was not always the case. There were parents who were able to work more hours, and that was another one of the points of contention at the legislature last year, that some folks felt that parents were taking advantage of the system by being paid for more than 40 hours per member per week. All of that has now been capped. There is a revised eligibility tool coming out. They're calling it the High Needs tool. It was introduced on October 1st of last year, but then the governor put a stop to it in the middle of October last year, feeling there needed to be some further work done on that. At this point, we don't know exactly when that new tool is going to be reintroduced or introduced in its final form, but we're presuming it's going to be in the fairly near future. We hope that's going to be the case. I think everybody's hoping that's going to be the case because there's so much uncertainty around it right now. And at least having the policy in place would let people know where things stand. What's interesting and important to note about that is it's going to have some age-related criteria associated with it. And the minor age member population is going to be most affected, more than anyone else. The adult population in the DD system and the All-Tech system is not going to be as affected, may not be affected at all, but certainly the 0 to 17 age group is going to be affected by that. We're presenting this update this week because it's what's called crossover week. Now, if you're not familiar with crossover week, I'll bet you all are, but if you're not, crossover week is the week between when House bills have finished being heard in the House of Representatives and Senate bills have finished being heard in the Senate. And those bills that have passed committee and passed a floor vote in each of those chambers now cross over to the other chamber. I don't know why it takes a week for a piece of paper to cross from one side of a courtyard to the other side of a courtyard, but it does apparently. I'm making light of it. I don't mean that. What's happened, this is crossover week, and a lot of people assume that nothing really happens during crossover week, but in fact, a lot happens. This week has been filled with floor votes in the House and in the Senate on the bills that passed committees in those chambers. And even after this week ends, a lot of the bills that passed committee are still not going to have been voted on by the full body. And so you'll see that in the next week and the week after, there will still be some House bills voted on the House floor, some Senate bills voted on the Senate floor before they get transmitted to the other chamber. At the same time, they're going to start voting on the bills from the other chamber that come to them and that end up passing in the opposite committees or the committees of the opposite chamber. And I hope I'm making sense. But basically, starting next week, the House is going to start hearing those Senate bills, and the Senate is going to start hearing those House bills that passed their chamber of origin, and we're going to start moving forward. And then, of course, the bills that pass in the opposite chamber will, generally speaking, land on the governor's desk. There may be some amendments. They may have to go back to their originating chamber for concurrence if there are changes or amendments made to the bills. But basically, the bills that pass both chambers are going to end up on the governor's desk. Whether she'll sign them or not, it's anybody's guess. We have already seen some that have gotten the veto stamp from the governor, and I'll talk about those when we get to that portion. But right now, it's all about staying alive. I hope some of you are old enough to remember Saturday Night Fever. If you're not, you missed out. It was an interesting time in American history. But right now, the key is for bills to stay alive, to get out of their originating chamber. And how are they doing? Well, when it comes to the election and voting bills we were talking about, there've been a lot of funerals for those bills. Every single one of these bills failed to either get heard in committee or failed in a floor vote. In this case, all of these failed to get heard in committee. There were some. These are both Republican and Democratic bills. You can see from what's on the screen here. Most of these were introduced by Democrats, and it's not a shock that when the Democrats are in the minority in either chamber, fewer of their bills get heard because all of the committees are chaired by members of the majority party, and the chairs of those committees determine what gets placed on a committee agenda. So a lot of these bills never got heard. In some cases, in the case of this election bill that Representative Bliss introduced, there were other bills that essentially addressed the same issues. And so her bill did not get heard, but those issues are included in other bills that did make their way through committee. On education, we've seen a number of bills go through, and the ones that are not crossed out here are the ones that are still alive but have not been voted on in their chamber, or at least as of the time I was finalizing this yesterday, they had not been voted on in their chamber. In the case of HB 2621, that is a bill that very directly affects the special education population in Arizona, but primarily people or students who live in outlying, rural, isolated areas where special education services may be harder to get or may not be equitable with the special education services in a larger town or city. So this is an attempt by Representative Gress to address that and to make sure that educators, that school districts and schools are doing a better job of ensuring special education equity for students who have disabilities. And then you can see that Senate Bill 1143 which addresses some safety issues on campuses around the state, has already passed the Senate, and that now is already in the hands of the House. There are a lot of health and safety issues that we were talking about when we did our original presentation in January. Some of those have fallen by the wayside. House Bill 2039, a bill that would require priests, would add a duty to report for clergy, priests, ministers, so forth. That is a bill, it's an evergreen bill. It gets introduced every year. It never goes anywhere in the legislature, but it probably will continue to get introduced. And by the way, when we talk about duty to report, that's a duty to report when they see that a person is being abused, neglected, or exploited. So you can probably imagine there are some obvious reasons why people object to forcing clergy to report. There are others, of course, who think that clergy should be no different if they see that going on. In any case, it's a bill that gets introduced every year, and so far it has never gone anywhere. But I'm sure we'll see it again next year. You can see that House Bill 2048 passed the House. The others are still alive, unless they're crossed out. 2178 is dead. By the way, we talked about this. House Bill 2178 would add a requirement to state law that the chief medical officer of any state agency that has a chief medical officer would have to hold a license, a medical license, in order to hold that office. Right now, it is not state law. If you can be a chief medical officer for Access or for ADHS or for the Department of Economic Security without holding a medical license. Interesting to note, huh? Arizona is a little bit of the wild, wild west on some things. In any case, these bills are still alive, and we'll see where they go. In all likelihood, if they passed out of committee and if they were sponsored by Republicans, they are likely to pass their chamber of origin and move on. Some other health and safety issues, an appropriations bill 2202 around dementia care and allowing telemonitoring of individuals with dementias, where either where staff can't be made available or where it's more efficient and more effective to do telemonitoring. That's an interesting bill. And like every other appropriations bill, if you see the word appropriation attached to a bill, you know that it may pass its chamber of origin, it may pass the other chamber of origin, but that doesn't mean it lands on the governor's desk. That means it lands in the pile of all appropriations bills and all appropriations proposals that get negotiated into or not negotiated into the state budget. So appropriations bills always have a higher bar than any other bills that don't include what they call a fiscal note or a cost. 2495 would increase the sentencing requirements for individuals who are found guilty of committing crimes against vulnerable adults, and that has a formal definition, by the way, in state statute. A vulnerable adult fits, as a person who meets certain criteria. Individuals with IDD, generally speaking, are considered vulnerable adults. So this would, if you committed a crime against that person and this bill were in effect, you would be looking at a higher mandatory sentence for the most part for your crime. There's what we think is I'll say personally, I think is a great bill, 2611, that would require some additional training for people who work in group homes around the state. Now, this one doesn't necessarily focus just on the DD community. It wouldn't perhaps have as great an impact on the DD community, but it would certainly have an impact on group homes operated by the Department of Child Safety. And then some other bills that you can see are still alive that we're sort of keeping our eye on. Look down at the bottom of this sheet, you can see Senate Bill 1002. It is was a bill that was intended to place greater restrictions on what people could use their SNAP benefits for, SNAP being Supplemental Nutrition Assistance Program. That is a federally funded but state administered program to provide nutrition assistance for needy individuals and needy families. Senator Kavanaugh introduced this bill because he, like a lot of his colleagues, feels that people should not be using their SNAP benefits for things like fast food, what they would consider and what they sometimes call junk food, basically any food that is prepared by the vendor selling it. Now, this is controversial for a lot of folks with disabilities and a lot of aging individuals because they may live in areas where they don't have access to a grocery store, either because there isn't one nearby or because they don't have transportation, they can't drive themselves, they may have mobility issues, they may have a variety of issues that prevent them from purchasing unprepared foods like at a grocery store. These bills, these SNAP bills, and there are several of them this year, would make it very, very difficult for people to get food if they couldn't buy it. Perhaps they have a Circle K on the corner, and that's where they can get a hot dog or some form of food that's already produced, or they may have a fast food franchise somewhere near them, and that's where they need to buy their food because they have few other options. So these SNAP bills this year do not take into account the kinds of limitations that people face, and that I think is why the governor is not in support of them. Granted, nobody wants to see taxpayer dollars wasted. Nobody wants to see taxpayer dollars used inappropriately. But some of these bills lack a little nuance and lack a little understanding of the real life circumstances that certain people face. And that appears to be why they're meeting resistance when they land with the governor. A couple of other bills around eligibility services, things that, available to people. Senator Fincham has once again he introduced this last year as well, a reimbursement rate increase for providers. This would be $45 million, which would then be matched basically on a 2-to-1 basis with federal money. This one is still alive, but given the state of the state's budget, it appears very unlikely that it is actually going to get built into the final budget that is issued whenever the legislature and the governor agree on a budget. So it's great. Senator Fincham has become a very strong advocate for funding the DD system appropriately, but in this case, there may just not be enough dollars to go around. So it's probably not gonna get implemented. You can see there's a bill that passed the Senate already from Senator Werner to prohibit access workers from working remotely. It would require that they be in the office to do their work. That has passed the Senate. My guess is the governor will not sign that one, but I certainly could be proven wrong. I've got Senator Fincham's bill here twice. My apologies for that. I've got both of these here twice. I didn't do a very good job of editing, so my apologies. I'll do better next time. A couple of other things. So those were the old ones. These are some new ones that came up since our last session. Representative Nguyen has introduced something to allow for electronic monitoring, basically video cameras or sound devices, monitoring devices in healthcare facilities. You may recall a couple of years ago, the legislature passed and the governor signed bills that allowed for group homes to have cameras in common areas if all of the residents of the group home or their guardians agreed to that. There's just common areas, not bedrooms or bathrooms. This would allow patients who are in intermediate care facilities, skilled nursing facilities, other healthcare facilities, long-term care, basically, to have electronic monitoring in their rooms if they so choose, or if their representatives, their responsible parties, choose to do so. It's meant as a way to essentially prevent the kinds of things we saw in the Hacienda incident back in 2018. So it is still alive. Representative Gress, who introduced one of those, the special education bill around expanding access to good special education services. He introduced a pilot program around sexual abuse prevention in the K-12 public school systems. This looks like it could have, it's just a pilot program to start, but it looks like it could have some great impact. And then you can see some other bills that didn't pass. Two that were really, we were really interested in, House Bill 4012, because it would require healthcare facilities to do enhanced medical testing and screening of patients with special needs who came into those facilities, but couldn't necessarily communicate what their symptoms were or what exactly they were experiencing. We know this is an issue in the disability community. A lot of folks are not able to communicate exactly where the pain they're feeling is. They may be demonstrating behaviors that show something is wrong, but they may not be able to explain exactly why they're behaving in the way they are. So this bill would have required that medical facilities do a vaster array of testing on them to determine the root causes of their discomfort or what's going on with them. That did not make it out of committee. Another bill related to special education eligibility for military personnel, the children of military personnel. As we all know, a lot of military personnel move from place to place every couple of years. It's often very difficult to integrate their children into the education system, whether they have disabilities or not, but it's particularly difficult for children who have disabilities. So this would have made it easier and would have provided some additional supports for those families when they relocate to Arizona. That bill also did not make it out of committee. And then one around changing stations. There was a push several years ago and a bill passed to enhance the number of adult capable changing tables in state-owned buildings. That has been a success, but it did not gain enough support this year to sort of expand the range of buildings in which those changing stations need to be made available. I have a sense that this is not going to go away. This bill may be reintroduced next year if Representative Abetia is in the House again next year. So a few other things, group home monitoring program. This is something that was introduced a couple of years ago. It is likely to continue. This does have an appropriation attached to it. And this is a program that's run by Disability Rights Arizona. It is likely to move forward. It's a relatively inexpensive program. So my sense is, and this bill, by the way, would make it a permanent program. I think it's going to keep moving forward. So some other things around the disability community. But really interesting, the legislature is doing something this year that it has done in the past, but not to anywhere near this extent. And that is, it's trying to go around the governor. It's trying to go directly to voters on a lot of the issues that matter to legislators. And not surprisingly, voting in elections is one of the big issues. So what they are doing is they are creating concurrent resolutions, concurrent motions, proposals that allow them to pass something in both chambers of the legislature that would then go directly to statewide ballot at the next general election. And that, of course, is in November of this year. Some of these ballot referrals include those things around voting in elections, and there's a variety of them, more of them than anything else. And in large part, it would make it would place restrictions on who's eligible to vote, how people can vote, whether they can vote by mail, how they can vote by mail. One of them would try to introduce what they call Florida-style elections in Arizona. And the fundamental issues there are getting faster results. Arizona is one of the slowest states in the nation at providing its final results of elections. So legislators want faster results. They also want to require that voters have state-issued ID, and they present that in order to vote. And this Florida-style elections bill would require that people reaffirm, people who use mail-in ballots reaffirm their mailing address every single year, rather than maintaining a permanent early voting list or another time-defined early voting list. It's pretty problematic because requiring people to reaffirm their address every single year, we all forget things. We may not do it. People are going to drop off the rolls. It's going to change the number of people who are voting in any given year. But this is going to go to the voters next year. There's also going to be a proposition around, or a referral around Proposition 123, which is around education funding. And we'll see where these go. Lots of different issues that are going to be addressed. These including whether we reinstitute the firing squad as a death penalty option in Arizona. Lethal injection's been pretty controversial in recent years. So who knows? Maybe a firing squad, in the eyes of some legislators, is a more humane and more effective way of putting people to death. We'll see. It's always a crapshoot when you refer something to the ballot because you never exactly know how people are going to vote. There have been some Republican-sponsored ballot referrals in recent years that absolutely did not go their way. There have been some Democrat-sponsored referrals in recent years that absolutely did not go their way. So you're taking your chances when you put something on the ballot. But in this case, the legislators who are pushing these referrals know with pretty great certainty that the governor is not going to sign a bill on this topic. So they would rather ask the voters directly to amend the state constitution or to put at least into statute the kinds of things that are interesting and important to them. So those are some new. And then, of course, If we have something old, something new, we have to have something borrowed. So we have a strike everything amendment around sub-minimum wage employment. Now, if you're not familiar with strike everything amendments, that's basically where the sponsor of one bill says he or she will give up that bill and strike everything, erase everything from the language of that bill, and let another legislator insert language that is important, that is on a topic that's important to them. So in this case, there was a bill introduced by Senator Gowan around who could be a circulator of petitions and who could get paid and how people could get paid for circulating petitions to get something on a state ballot. So Senator Gowan said, you know what, I'm going to give up on this and I'm going to let Senator Farnsworth insert a language around sub-minimum wage employment to maintain sub-minimum wage employment in Arizona. Now, the national trend is moving away from sub-minimum wage or 14C employment. A lot of people with disabilities historically have worked in what we call sheltered workshops. Provider organizations have established contracts with for-profit companies, and then individuals who were receiving services from those provider agencies would be given a job, and they would get paid for that job. It could be putting parts for furniture assembly into little bags that then go into the furniture packet. It could be a whole variety of different things. It couldn't even possibly go through the range of things that it might involve. But generally speaking, those individuals were paid far less than minimum wage in order to do that work. Some people could be paid as little as 30 cents per hour to do that work. Well, as I said, the national trend has been to move away from sub-minimum wage and to move toward it requiring that all individuals who are employed get it paid at least the federal minimum wage. For some reason, Senator Farnsworth believes that it is important for Arizona to maintain the right of 14C certificate holders to continue paying sub-minimum wage. Now, this is an issue that for the council, it's a very difficult one for us. We have been strong proponents of competitive integrated employment, which means offering people employment in the community and at least prevailing wage, because we believe that people with disabilities deserve that opportunity. The counter argument is that a lot of folks will never be able to hold down competitive integrated employment. And so if we do away with sub-minimum wage, these vendors, these companies will not be able to pay enough, or the services the individuals are providing are not worth enough to be paid minimum wage. Lots of different arguments about it. In any case, this one is still alive. It is likely to pass the Senate. And largely, we think that's because there's not much understanding of the issues here. It seems like a very simple issue on the surface, but there's a whole lot more to it. And as I said, the national trend is to move away from sub-minimum wage. And so we think it's a bit of a dinosaur, and we think there's a lot of advocacy work that could be done around this issue to help make our legislators more aware and help them see the wisdom of competitive integrated employment and providing prevailing wage employment to every person who wants to work and is capable of doing so. So let's talk about something blue. How difficult is it to get a bill through the Arizona legislature? Well, Arizona Agenda, which is an online, it's basically a blog, published this a couple of days ago around certain committees, and these are as you can see, if you can see the language at the bottom of the graph there, it says the number of bills each committee voted on compared to the number assigned to it, and this is excluding any bills that were withdrawn, because sometimes bills do get withdrawn. To make the comparison somewhat fair, we looked only at committees assigned at least 75 bills and identified the 3 committees in each chamber with the lowest share of bills that received a vote. You could say pretty much across the board, more bills get introduced in committees than ever get heard. These are some examples of committees where very relatively small minority percentages of the bills actually got heard. In the Commerce Committee, 102 bills introduced, 51 got heard, so 50%. Or I'm sorry, 102 didn't get heard, 51 did get heard, so a third of them. In Judiciary, 71 didn't, 56 did. You can see the numbers there, I won't go through them all. But basically, you can see it is very, very difficult. The bar is very, very high, regardless of whether you're a Republican or a Democrat, whether you're in the majority or the minority. This year, by the way, This year, the legislature received a record number of bills. More than 2,100 bills were introduced in the Arizona legislature this year. The highest number that I can recall in almost 15 years doing this work was a little over 1,800. And even that's extraordinary to try and process in a 3 to 4, maybe 6 week period. 2,100 bills this year, and the vast majority of those were from the majority party. But even then, the vast majority of those are not getting heard, not getting a chance to be put before the public. Sometimes that's not a bad thing. Sometimes it's a good thing. But I think it's fair to say that some very good legislation, some potentially very good legislation, did not get a chance to see the light of day in this particular legislative session. So I'm going to finalize my talk about the state by talking about the budget, because we know that the budget matters more than anything else. As a recap of some of the things we talked about, the governor introduced her budget proposal back on January 16th. She actually introduced it the afternoon of the day we did our first legislative preview from the session. At the time, everybody expected that budget proposal for DD services was going to include $56 million, because that's what we've been told. In the end, that afternoon, we found out it was actually $128 million, and nobody could quite understand why. Why was it more than double what everybody'd been telling us it was going to be? Well, there are a lot of reasons for that. I would say in the end, it's not a bad thing. Certainly the system needs the money. Whether all of that money will come through or not is very much an open question. But the reality is that the governor's office was making certain projections and was coming to certain conclusions about where the system is going. And I think the long and short of it is they decided to err on the side of asking for more as opposed to asking for too little. We all know that the shortfall in DDD services last year was $122 million. Nobody seems to expect, including the folks at DDD and DES, at Access, at the governor's office, nobody seems to expect that it's going to be anywhere near that large this year. In fact, some people have said there may be no shortfall at all. I have difficulty believing that could be the case, but the governor's office, I think, decided that it could justify asking for more just to be on the safe side. And if it doesn't need all that much, then it doesn't spend all that much. Here's the biggest issue right now. We didn't talk about this a whole lot back in January, but it's really coming to the fore now, and it is what is stalling state budget negotiations: tax conformity. HR 1 included a whole raft of tax cuts for corporations and for individuals. The state of Arizona now has to decide if our state tax structure is going to be rejiggered to conform with what's in HR 1. Are we going to give the same tax breaks at the state level to corporations and to individuals that HR 1 gives at the federal level? Well, why not? Because if we give those same tax cuts, the state revenues drop precipitously. And the state really can't afford that if it's going to continue to provide the range of services the state currently provides. And by the way, this is more than just DD services. This is public safety. This is roads. This is state parks. This is everything the state is involved in would be affected by the decision on tax conformity. You've probably heard in the news lately about people being a little hesitant to file their tax returns for 2025 because they don't know how it's all going to play out. They don't know if they're going to have to refile once this tax conformity decision is made. So it's affecting people's lives already, and no decision has been made yet. And ultimately, when that decision is made, the governor supports giving the tax breaks to individuals, but not corporations. The Republicans in the legislature support giving the tax breaks to all corporations and all individuals who are affected by HR 1. The House and Senate already passed a bill that landed on the governor's desk and that she vetoed that would do exactly that, give all of those tax breaks to everybody. So they're now in this negotiation phase to see what they can compromise on that will work for the state budget and not throw us into a real budget crisis. Stay tuned. Okay, with that, I'm going to stop You'll probably all be glad about that. And I'll take any questions that may be out there. Sarah, I have not been following the chat, but do you want to tell me what's in the question pool?
Sure, yes. We had a few people answer their own questions. One early question came from Jasmine. She had a question regarding you were talking about the paid parents as caregiver program, and she asked if that was had something to do with the protest in Phoenix. Jasmine, feel free to add more in the chat. I'm not sure if I got your question correct. So we'll wait to hear from Jasmine on that. But Angela is asking, is this a non-political group? Doesn't seem so. Maybe that wasn't, it is just a rhetorical question from Angela. This would be a great time for folks to ask any questions about the bills themselves. I know that there was many aspects covered. But Angela, yes, this is a nonpartisan group here at the council. Doesn't
Yeah,
look like
Sarah,
there's any
I'll address
specific
that.
questions. Yeah.
Yeah, I'll address that. And Angela, I appreciate your question. What I typically say is, I am not objective, and the council is not objective. We try to be fair, but we are not objective. Our job is to advocate for individuals with intellectual and developmental disabilities and to advocate for individuals with disabilities more broadly. So when we see issues come to the fore that would disadvantage people with disabilities, we generally call people out on that. We try to educate. We don't, I'm not saying that these legislators who are proposing these bills are bad people. I think largely they may not understand disability issues, and they may not understand why the disability community needs the level of financial support as well as philosophical support that it needs. So I'm not taking a position on them as individuals. To be honest, anything I say about a bill is really a personal perspective, but there are some bills that clearly would be more damaging to the disability community than others. And so we feel we have an obligation to educate the community members about that and to educate our legislators about those things. So if I'm coming across as partisan, my apologies, that is not my intention. There are some bills, there were some bills introduced by members of both parties this year that were pretty ill-informed when it comes to serving people with disabilities. So you know, if you want to have a conversation about the bills that Democrats introduced that wouldn't be good for this population, I'm more than happy to talk about that as well. It is not my intention to come across as partisan. It's just my intention to be truthful about the good or the ill that particular pieces of legislation would do for people with disabilities.
We have some clarification from Jasmine. She was linking to an article or mentioned an article regarding the governor pausing drastic cuts to children's disability services. And yes, that had to do with the entirety of the system, Jasmine, including the PPCG program. Jeremy asks, are you following or monitoring the recent moratorium on new DME providers nationwide that was announced this week? Alicia also is wondering about that. Jon, would you like to address that?
Yeah, I actually am going to talk about that in just a few minutes because that's one of the many dangers facing Medicaid right now. And obviously, it's going to have an immediate impact on a lot of folks in the disability community. So I will be talking about that in just a minute.
Erica asks, is the paid parent caregiver program going to remain a thing? What was the cap on hours, and is there a level of autism that is not eligible for that?
Yes, it is going to remain a thing. It is written into our Medicaid waiver that the Parents as Paid Caregivers program is a permanent part of DD services in the state of Arizona. And unless Access decides to go back to CMS, the Centers for Medicare and Medicaid Services, and request a change to our waiver that would eliminate that, it is going to remain a part of the waiver. Now, yes, there are going to be some changes to the eligibility or the hours assessed for individual members. That's kind of the big to-do right now. What was introduced in October of last year made some really dramatic cuts, well, I should say it made some really dramatic changes that would have resulted in cuts to the hours assessed to minor age members. And it was felt by the governor's office, as well as by a lot of folks in the community, that policy was ill-advised, that there hadn't been enough effort put into it, there hadn't been enough community input involved in it, and so that's why the governor's office put a halt to that on October 16th. Now, what we do know is that the legislature, as part of its funding for the DD service system last year, as part of making up that shortfall in funding, the legislature mandated that changes be made to the system so that eligibility was essentially tightened up. Basically, they wanted to make sure that only those who truly needed services were getting services, and they felt that eligibility was too lax right now. So that's why Access put its new policy in place to have more rigorous standards and ultimately to probably cut the eligibility or the hours assessed for a lot of members. That hasn't changed. That is written into the law or the bill that was passed last year that became part of the supplemental appropriations. So Access is still, under that mandate to institute changes and to make eligibility standards more rigorous. And so, although the Parents as Paid Caregivers program is going to remain until Access requests that it be changed, it is probably going to become more difficult for some members to get the full range of hours that they have been given over the last couple of years. And I hope that explains it. One of the problems we have right now is that since the governor put a stop to that program, Access has been working on revising and taking into account more public input, but we really have nothing more to go on than what we had 6 months ago. What we don't know far outweighs what we do know, and we still don't know when the new policy is going to be released to the public. But I think what we can be certain of is when the new policy is released, it's going to be the final version of that policy. They're not going to go back to the community for more input, and they're not going to be willing to make more revisions to it.
Right, we have another question from D, and this is about Supreme Court cases about the disability community. She wants to know, are you going to be including updates on court cases in a future update?
Oh, gee, I hate it when the lawyers start asking questions. I guess we can. We will probably we will have to do a lot more investigation than we have been doing, because so far we've kind of been going off of the headlines, and I don't mean that quite the way it sounds, but yes, we can include more on some of the court cases that will affect things like the freezes on Medicaid funding in Minnesota and a few other things that really have an impact on the community. There are, as you might imagine, a tremendous number of legal cases right now involving efforts on the part of the administration to freeze, cut, rescind funding for various programs around the country. And it covers really every area that the government funds, well beyond just disability services. So there's a lot to try and get our hands around, and we'll do the very best we can. But we probably will include more in our newsletters and in our policy perspective blog than we will in these updates.
Great, looks like that's the end of the questions about the state bills. We did have some additional thoughts shared in the chat, and I believe it is time for our next section.
Okay. And by the way, I really want to quickly touch upon Brandy's comment around 14C. Brandy, I completely understand both both sides of this, both perspectives, and we certainly don't want people to lose the opportunity to do work that's meaningful to them. What I think we have to bear in mind is that other states have been very successful at phasing out their 14C programs and ensuring that all individuals have meaningful work opportunities. So there are some examples we can draw from. I don't think it's important that we enshrine in state law that this 14C program will be institutionally supported by the state of Arizona. I think we're in a sort of an evolutionary stage right now where some really good things are happening to heighten the availability of competitive integrated employment and to ensure that those folks who won't qualify, don't have the skills for that, are still given meaningful work opportunities, but are paid better than 30 cents an hour to do that, or or far less than minimum wage. So I think we have some work to do to make sure that our legislators and our other policymakers understand that and are looking at what those options might be before they, as I said, enshrine these things in state law. Okay, so I'm going to move on to the federal. And last time we met, you may not have been there, but for those who were, we were still under a continuing resolution, and that meant that the government had not passed a budget to fund the federal government through September 30th of this year, which is the end of the federal fiscal year. Well, not long after that, they came to an agreement of sorts, and a new federal budget was passed and signed by the president on February 3rd. So the continuing resolution ended in a very, very brief federal government shutdown, a shutdown of about 3 or 4 days. What's interesting about that federal budget, as you probably know, is that a lot of the negotiations, the reason there was any question about getting a new budget passed before the continuing resolution expired was that Democrats in Congress were very upset about what was happening in Minneapolis around immigrations and customs enforcement. And they were unwilling to pass a federal budget unless and until Senate and House Republicans were willing to negotiate some changes to the way ICE was operating. So there was a threat of another potentially long federal shutdown, such as what we saw last fall. In the end, they came to an agreement to fund everything, and the big ones that were still hanging out there as of January were labor, health and human services, and education. That's one block of funding, and then defense. The Defense Department is far and away the largest expenditure of the federal government, and labor, health and human services, and education is the next largest. So together, those are over 70% of the federal budget, and those were the two biggest budgets that were still unresolved in January. Nobody wanted another shutdown, so what they did is they decided to carve out the Department of Homeland Security, which is the parent agency of Immigrations and Customs Enforcement. They would fund everything else, but they would go back into negotiations about how DHS would be funded, when it would be funded, what would be required in order for it to be funded. That, by the way, has still not been resolved. So as of today, DHS, that's the federal DHS, Department of Homeland Security, has no budget for this year. And so a lot of folks who fall under that umbrella, like Transportation Security Administration folks, the folks at the airport, they are working without pay unless the government shifts money from one thing to another in order to make sure they get paid. There are a lot of DHS employees right now who are still working without pay because there is no DHS budget. By the way, you're also probably aware that that has not really affected ICE and its work because HR 1 included a special provision of about $75 billion in funding for ICE specifically. And so that money is primarily being used to fund ICE operations right now. One of the things that was a big area of concern back in January, not so much today, is the Affordable Care Act and the enhanced subsidies that were helping people afford their ACA premiums. Those expired. Those expired on January 30th. And if you're not familiar with the enhanced premiums, as everybody probably knows, the Affordable Care Act or Obamacare marketplace included a variety of plans, and depending upon your income level, you might be eligible for a certain subsidy to help you pay for the premium on that on that marketplace plan. More than something like 80%, 90% of Americans who bought marketplace plans qualified for some level of premium. Well, during COVID, the Biden administration instituted enhanced premiums, so even bigger or enhanced subsidies, even bigger subsidies to help people pay for their marketplace plans because the economy was in turmoil and people were having difficulty affording things and employment was higher and a variety of factors. Well, those enhanced subsidies had a shelf life, and January 30th, 2026 was the end for them, unless they were renewed, extended, changed, something like that. There were a variety of efforts to get them extended. There seemed to be some momentum to do that. Ultimately, nothing came to fruition. And at this point, Congress doesn't want to deal with it anymore. Healthcare needs have not gone away. Insurance needs have not gone away, but Congress has other things to focus its attention on now. So all of those things that failed have kind of gone by the wayside. And so what it means is that a lot of people who have ACA marketplace plans are paying substantially more now than they were paying last year. In some cases, 100 to 120% more in premiums than they were paying last year. It really sort of varies depending upon the state. Different states have different insurance marketplaces, and so premiums vary. But a lot of people in the U.S. now are paying a lot more for marketplace plans than they paid before. And what it means is a lot of people have dropped their marketplace plans and no longer have insurance coverage because they couldn't afford it. Well, on January 15th, the president introduced what he called the Great Healthcare Plan. There was a lot of fanfare around this, and then there was a lot of criticism of it. Because if you remember, and I know I said this last time, if you remember back before the election in 2024, the president was asked in a debate, do you have a plan for replacing the Affordable Care Act? And he said, I quote, "We have concepts of a plan." Well, the Great Healthcare Plan is an example of concepts of a plan. It is a very, very broad framework for establishing a replacement for the Affordable Care Act that would provide healthcare coverage to Americans who could afford it or wanted to buy it. There are a lot of problems with it, though, especially with regard to the disability community. It might exclude pre-existing conditions. And that was one of the great things about the Affordable Care Act. And believe me, again, I will admit there were absolute problems with the Affordable Care Act. But one of the great things it did for people with disabilities was it ensured they could get coverage, which was not always the case before the ACA went into effect. So pre-existing conditions might be excluded. There would not be any direct subsidies. There would be some credits that would be made available to people to help them pay for their premiums. Although it said it was going to focus on lowering costs, there were no specifics in this plan, this broad framework around how costs would be lowered. And essentially it threw the ball into Congress's court to flesh out the framework, the outline that was introduced. Well, with lots of other things on their minds, Congress has not done anything on this since it was originally introduced. Perhaps at some point they will. We hope so. In the meantime, the Affordable Care Act, in a certain form or fashion, remains in place. But again, it's more expensive for people to buy the plans, and a lot fewer people have the plans than they had last year. Medicaid. We could talk all day about Medicaid. It is, for those who aren't familiar, and I say this without being critical at all, but we're always surprised to learn how many people do not understand or do not know that Medicaid, the federal Medicaid program, funds DD services in Arizona, along with lots of other things. But it is the primary source of funding for home and community-based services. It is the funding source for the overwhelming majority of what the Arizona Healthcare Cost Containment System, or ACCESS, provides. ACCESS is our Medicaid agency in Arizona, and the Development of Disabilities, something like a Division of Developmental Disabilities, something like 95% of its budget comes through ACCESS as in the form of Medicaid funding. So just to make sure everybody understands that, what happens to Medicaid matters to people with disabilities. The range of things that Medicaid funding covers is vast. As I said, we could talk all day about it, but there are a lot of things that people would never assume it covers that it in fact covers. And the intent in large part is to make sure people don't have to be institutionalized, to make sure they can live in their communities, they can have good health care, they can have good supportive services, they can have good therapies, they can live high quality of life in their communities and not have to live excluded from the communities in which they were born or in which their families live. What's happening now, and I mentioned earlier that HR 1 included about $1 trillion in Medicaid cuts over 10 years. What's happening now is that that burden of Medicaid cuts is being thrown back on the state Medicaid systems. The problem is states don't have the kind of revenue to make up for the shortfall that they're going to face. Every state, not every state, but most states are facing tighter budgets, partially because fewer federal dollars are coming in for many things. But also because, you know, the economy fluctuates. Some years are good and some years are not good. Arizona right now, also as I mentioned earlier, Arizona is facing some budget challenges, part of which have to do with tax cuts that were implemented a couple of years ago, part of which have to do with economic variations and, you know, are people continuing to move here? Are employers continuing to locate here? Are employers moving out of state? You know, those kinds of things that are part of basic economics. But there's also the issue that home and community-based services, which are provided currently in every state across the country, are optional. Even if your state has a Medicaid system, it is not required to provide home and community-based services. And because they're not optional, they are likely to be among the very first things that get cut or shrunk when cuts are made to state budgets. They account for very large expenditures for most states. In Arizona, on a per person basis, perhaps more than in any other state because of the type of system we have. And we already see that states across the country are looking at ways to cut their Medicaid systems in order to balance their budgets or to provide further tax cuts or to do both. Family caregiver programs, like our Parents as Paid Caregivers program, are being reduced or cut in Washington, Colorado, Missouri, Maryland, whole variety of other states where they've had some form of that, and they are now looking at reducing those as a way of meeting their budget needs. So lots of changes are likely to take place in lots of different parts of the country. Further complicating things is that last Friday, there was a release of data, of HHS Medicaid data to the public that was all put together by DOGE, the Department of Government Efficiency, that was active, you know, for about the first 6 months of the current Trump administration. Well, they collected a whole bunch of data. HHS already collects a whole bunch of data. They took all of this data and they compiled it together, and then they just issued a report without providing any context of what the data actually meant. And there are lots of different ways to interpret this data, but the reality is that without some context explaining why Medicaid expenditures are as high as they are, why they are as high as they are in certain places, you know, without really explaining what Medicaid and its home and community-based services programs in particular fund and how they fund them, it's very difficult to draw any reasonable or realistic or accurate conclusions about that data. Instead, now that this data dump is out in the public, a lot of folks are drawing conclusions that are a little bit misinformed. And they're looking at the number of dollars being spent and they're thinking that is extraordinary and the federal government should not be spending this much money on such a small population of people. Well, that's one way of looking at it, but the reality is much more nuanced and much more complicated. So there is an effort on the part of a lot of people, especially in the disability community, in the community of people who receive home and community-based services or provide them, to explain these things. But you can imagine 6 or 7 years worth of data collected from states across the country, just sort of laid out there. It's going to take a lot of explanation. It's going to take a lot of parsing and a lot of reconfiguring the way that information is presented in order to make sure there's an accurate picture of why HCBS and Medicaid writ large make such a difference for people around the country. But when things like this get just laid out there without any context and without any explanation, it makes it very difficult to get that accurate picture. So there are some other threats to Medicaid. If you watched the State of the Union address the other night, you may have noticed that healthcare received virtually no attention in that. Healthcare accounts for almost 20% of our nation's economy, and it received virtually no attention in the State of the Union, even though it affects virtually every American in some way. And that is because the current administration is focusing on what it believes is an extensive amount of fraud, waste, and abuse in federal programs and in state programs that support people who have healthcare needs or service needs, like the other services provided by Medicaid programs. The Vice President Vance, is now in charge of what the administration is calling a war on fraud. And a statement was made by the president just within the last couple of days that this war on fraud will be so effective that it will lead to a balanced budget in a relatively short period of time. We are hundreds of billions of dollars in the red as a nation. So balancing the budget on the backs of Medicaid waste, fraud, and abuse is suspect. It is unlikely to occur because that many dollars probably are not even spent in the Medicaid system on an annual basis. So it's a bit of hyperbole, but it is certainly the administration's desire to root out waste, fraud, and abuse wherever it can find it. And so the administration is taking a lot of steps. Now, it's important to note we live in a nation that is supposed to have checks and balances, and the executive branch of government, the administration, presidency, has certain powers, but the legislative branch, Congress, also has certain powers, and Congress is supposed to be working with the executive branch on a lot of the things that the administration is basically just doing on its own. So there isn't a lot of parity. There isn't a lot of collaboration in many cases between the two branches of government right now. And that is, to a large degree, why so many things are landing with the judicial branch, why so many things are ending up in courts, and ultimately, in some cases, in the Supreme Court for adjudication about whether they are constitutional, whether they are appropriate for one branch or the other to take on without the consideration of another branch. It is an interesting, I think if you're a constitutional lawyer, or if you have an interest in how the Constitution is put into practice in this country, it is interesting to see what's happening in our country on that front these days. So among the other threats, I mentioned that the Vice President is leading this war on fraud. The Centers for Medicare and Medicaid Services just announced a couple of days ago, and you can see the Vice President there along with CMS Director Oz. They announced that they are halting Medicaid payments to the state of Minnesota, about $250 million, $260 million in Medicaid payments to Minnesota, because they think the fraud in that state is so extensive that the federal government should not be spending any more money there until they get their act together. This is an extraordinary and unprecedented move. It's never happened before that an administration has simply cut off the Medicaid funding. They have every right to address issues. It is important that every state's Medicaid system be above board and be operating by the rules. But to simply cut off funding, what's the impact of that? Well, obviously, if there's no Medicaid funding, the people who rely upon Medicaid services, rely upon the things that are funded by Medicaid, will not receive those things. So in fairly short order, it can be assumed Minnesota Medicaid recipients are going to start seeing challenges related to healthcare, related to DD services, related to nutrition assistance, related to a whole variety of things that they have been counting on. So the state does have the right to appeal. They have 60 days to appeal. I think Minnesotans are hoping that that they do that much more quickly so that they don't get put in a more difficult position. In addition, there was a report issued in January by the Paragon Health Institute related to waste, fraud, and abuse in Medicaid systems. And I want to point out that the Paragon Health Institute is a very conservative think tank. It is affiliated with the folks who brought us Project 2025. And so it will become as no surprise probably that this report is very critical of Medicaid systems. It essentially says that the structure of Medicaid systems makes it so that waste, fraud, and abuse are practically invited, and that the decentralized nature of home and community-based services and self-direction are just ripe for abuse. That the way Medicaid systems work, there's not enough centralized oversight, and that instead we should be looking at the institutional model, at how well managed the institutional model is. Well, for advocacy organizations like ours, promoting any kind of institutional model immediately raises a red flag, because we know that the history of institutions in America was in fact abusive, was violent, was not in the best interests of individuals with disabilities, and did not lead to good outcomes, nor did it lead to community inclusion. What's also interesting is that the argument made by the Paragon Institute about the need to cap Medicaid funding, to cut Medicaid funding, and to further investigate where Medicaid funding is being misused, based upon this notion that decentralization is a bad model to follow, is it's interesting that the folks at the Paragon Institute are very much aligned with the folks who push for decentralized education systems and education choice. And I'm not making a statement about education choice. We have a model of education choice in Arizona, a model that's being followed by a lot of other states. But it seems to me a little disingenuous to say that a decentralized model is bad in one instance, but good in another, when we're still talking about a lot of federal dollars going into both of those systems. So it's a little bit contradictory in the way they're presenting this. Some states, as I mentioned, have already decided to make cuts. The governor of Idaho recently proposed that all, and I mean that, all home and community-based services be removed from Idaho's Medicaid waiver. Imagine the devastating effect that would have on people who rely upon home and community-based services. Now, fortunately, there's been some movement to try and rein in that proposal. A lot of legislators in Idaho are kind of backing off because they see the harm it would do. But the Idaho legislature is in one of those positions where they want to enact more tax cuts for the population of Idaho, but they don't know how to pay for those tax cuts. And so they're looking at basically the low-hanging fruit. And HCBS is part of the low-hanging fruit. So if HCBS cuts get enacted in Idaho, everybody who relies upon them would end up receiving, a lot less than what they're getting right now. There's also the issue of work requirements. HR 1 included Medicaid work requirements. Now, the argument was made that that there are exceptions to that. And by the way, we have some work requirement bills introduced in the Arizona legislature this year as well. All of them have exceptions for people who, by reason of disability, cannot be employed or cannot meet the employment requirements. So in that sense, they are taking into account individuals with disabilities. But once again, our legislators are not necessarily experts on disability, and so they may not have a full picture of how disability affects the life of an individual who has disability and what challenges that may face. And so it's very concerning when work requirements get instituted, because they often are painted with a broad brush. They're kind of a cookie cutter approach to ensuring that state and federal money is not wasted, and they don't always account for the nuances involved in people's lives, the lives of people who have disabilities and those who provide care for them. So later this year, people who might be subject to work requirements are going to be notified of that. They are going to go into effect on January 1st of next year. And they literally could affect tens of thousands of Arizonans who currently are receiving Medicaid supports. Now, if they can meet the work requirements and if they can be reassessed on according to the calendar that's being instituted and all of that, they can maintain those supports. But the redetermination process could prove onerous for a lot of people. And there are, again, just so many different incidents or so many different components of a person's life that could play into this. it really could affect a lot of Arizonans and could make them lose services that they're currently receiving. How would it affect caregivers? Well, it's going to affect caregivers because a lot of caregivers have given up employment in order to provide care, whether it's to their children or to their adult, or whether they're minor age children, their adult children. We already know that there is a shortage of direct care workers and direct support professionals across the country, and requiring people to go back to work and give up the care for their family members could exacerbate that issue, could make it almost impossible for a lot of people to get the services they need because there won't be enough providers for them. In addition, some of the federal actions that are being taken around immigration are already having a dramatic effect because, little known fact, almost a third of the direct care worker and direct support professional workforce across the country is made up of immigrants. And some of ICE's actions have, well, first of all, a lot of people have left the country voluntarily in order to avoid deportation. A lot of people, as we know, as we've seen, are being taken into custody by immigrations and custom enforcement. And you know, in some cases, they are being taken out of the workforce. Other folks are simply hiding because they don't want to be taken into custody. And that means if they work as caregivers, they're no longer working as caregivers. And so we're doing even more damage. And by the way, these are people who are overwhelmingly in the country legally. They're employed through the various eligibility programs and enforcement programs that are required by the federal government and state governments. But they're afraid, nonetheless, that they may be taken into custody and they may be deported, even if they're here according to the law. So we're looking at potentially dramatic impacts on the caregiver workforce as a result of other federal policies that are currently being implemented. And then there's the effect on rural healthcare. And I talked some about the Rural Health Transformation Fund at the original presentation. I'm not going to go into any detail on that, but the fact is that HR 1 posed some dramatic challenges for rural healthcare providers, especially because there will be fewer Medicaid dollars to pay for the services that patients are going to need. And it's going to put those rural hospitals and rural clinics in more of a bind. The Rural Health Transformation Fund is intended to offset some of those challenges, but most estimates say that it's only going to cover about half of what's needed over the next 10 years or so. So we're in sort of a wait and see mode. The state of Arizona has gotten $167 million per year for the next 5 years to try and invest in rural healthcare programs. Access and the governor's office are putting out RFPs to agencies and entities that want to utilize those funds. We hope, we anticipate that it will make a positive impact. We just hope that it's going to be enough, because as we know, a lot of people with disabilities live in rural, isolated communities where the access to healthcare, the access to therapies, the access to DD services can be more challenging. We don't want that to become even more challenging because the money is not there to fund those services. And then there's education. President Trump made it very clear during his campaign that he would like to see the elimination of the Department of Education. This has been a talking point for many conservatives for a number of decades. And more action has been taken in this administration than in any prior one to make that a reality. So the Department of Education is currently in the process of moving some of its programs outside of its own walls and into other state or other federal agencies, such as the Department of Labor or the Department of Health and Human Services. HHS now oversees the grant programs that touch upon safety programs for people with disabilities and community engagement for people with disabilities as they relate to public education in the United States. And the Secretary of Education has said that she very much wants to move all of the special education programs out into the Department of Health and Human Services. And so far, there's been enough resistance to that from Congress and from others that hasn't taken place. But the Department of Health and Human Services is in fact doing much more that relates to students with disabilities than it has in the past. The Office of Special Education and Rehabilitative Services remains within the Department of Education. But once again, the Secretary has said that she very much wants that to be transitioned to another department as quickly as possible. She would like to see it in HHS. That is its most likely designation or destination, but so far that hasn't happened. And that matters for obvious reasons. I think it touches upon students who receive special education services as well as transition services. And it's the office that oversees compliance with the Individuals with Disabilities Education Act and some of the, civil rights programs that affect students with disabilities. So what happens with OSERS really matters to the disability community, especially the children, the students who are still in public education. When something will happen, we do not know. What we do know is that HHS is doing a lot more now around students with special needs than it ever has before. And in all likelihood, it is going to continue amassing more of a portfolio in that area than it has had in the past. So what we know, and again, I apologize if this seems partisan. It's not intended to be. If you look at virtually any poll that is done around the nation right now, you can see that a lot of these actions by the administration are overwhelmingly unpopular. The American public does not approve of a lot of things that ICE has been doing. Not necessarily that they disapprove of immigration enforcement. They just disapprove of some of the, basically the violence that has been associated with it. They would like to see it done in a different way. There is also large-scale disapproval of moves that have been made in the healthcare arena. Medicaid is overwhelmingly popular among conservatives and liberals and everybody in the middle. Somewhere in the neighborhood of 75 or 80% of Americans believe the Medicaid system, as well as Medicare and other safety net programs, are essential in order to support Americans' quality of life. So much of what's been done does not meet with the approval of the American public, but it is part of the administration's agenda nonetheless. But what's happening as a result of that is that a lot of folks in the House and the Senate are now feeling like their seats are at risk. As I mentioned, the entire House of Representatives is up for election or re-election this year. 33 Senate seats, well, 35 actually, when you count the 2 seats that are vacant because of Secretary Rubio and Vice President Vance. So a lot of seats in the Senate and every seat in the House is potentially at risk this year. And a lot of Republicans would like to distance themselves from some of the administration's policies. How they're going to do that, if they're going to do that, it's an open question. It will be interesting to see. But one of the things that is very much on the minds of a lot of people right now is how the administration will respond to this. There is a bill running through Congress right now. It is passed the House. It is sitting in the Senate, and the Senate has really taken no action on it yet, called the Save America Act, and it is a voting-related bill. It is a bill that would tighten the ID requirements of Americans who wish to vote. You would have to have special forms of identification in order to become registered to vote. It would tighten some of the timelines around voting. It would make it very difficult for a lot of Americans to cast a ballot. And why does this matter for people with disabilities? Well, it matters because the types of identification in particular that would be required, and by the way, this is all an attempt to ensure there is no fraud in the election system, and that is a goal we all share. We do not want people voting if they are not eligible to vote. The provisions of this bill, however, are pretty onerous, and it would require types of identification that a lot of people do not have access to. A passport, other types of federally approved identification that people have to travel great distances to acquire. It would basically disenfranchise a lot of people and place time limits on the type or how long a piece of identification was still valid. It would remove people from voter rolls. it would make it very difficult for a lot of them to become eligible to vote. And we think it's contrary, or I will say, I think it is contrary to what our country has stood for 250 years, and trying to make sure that as many people as possible who are eligible to vote actually are able to exercise that franchise. What will its fate be? It's hard to say right now. As I said, it's meeting resistance in the Senate, and whatever good provisions there are in the bill, there are enough bad provisions that a lot of Democrats are trying to block its passage. There's also, and this might be a stretch, but there's more and more talk about it. And as you can see, there's an article from the Washington Post about whether the administration will take the truly extraordinary step of declaring a national emergency in advance of the 2026 election, so that there could be federal control of the electoral process, and potentially swing things in to the advantage of the party in power right now. As you probably know, elections, whether they're federal or state elections, they are administered on a state level. If the administration were to declare a particular type of emergency that some people believe they have the power to declare, they could assert federal control over the elections, and they could probably determine out of hand who is and isn't eligible to vote. You know, it might seem like a stretch, but the fact that it's being addressed in national media sources really has to give one pause and make one wonder, where are we headed? So, on that note, let's talk about what we do and how we can have an impact. And I probably waited far too long to get into this, but I mentioned that ADDPC, the council, is an advocacy body, and our job is to advocate on behalf of people with intellectual and developmental disabilities. That's what we do. We meet with legislators. These photos you see here are from what we called Lunch with Legislators, a series of very casual lunch events that we held back in January, just before the session started, or actually the first week of the session as well, where members of the legislature came to meet with people from the disability community, and just, as I said, informally talk about issues, hear from their constituents, what matters to them, why funding matters, why supportive education programs matter, why public safety programs matter. And we were really, really pleased with the people who came to see us. You can see in these photos, Senator Kavanaugh came, Representative Gress came, Representative Taylor was there, Senator Angus was there. We had many more than what you see in these photos as well. But this is how we share what matters to the disability community, and this is how we would encourage you to share what matters to the disability community. Our legislature is truly a citizen legislature. These folks come to Phoenix; they're elected to hold office, but they generally come from, you know, some kind of professional background, as teachers or as lawyers or as insurance agents or as doctors or as, you know, a whole variety of things, and they don't necessarily know about the incredible range of things they're going to have to deal with as elected officials. So we have an opportunity, and I would say we have an obligation, to educate them about those issues. And in our case, we're primarily educating about disability issues. They are, during the session, it may be more difficult to get to them, but when they're out of session, they generally love to hear from their constituents. And we hope that as legislation goes through that you have a particular feeling about, you will let them know through the request to speak system or through a direct email or direct phone call to their office how you feel about that legislation and why it would have a good or an ill effect on your life or the people or the lives of people that you care for. Advocacy cannot be overstated, especially in a state like Arizona. The role of advocacy is it's just all important, and we encourage everyone to be an advocate in whatever way makes sense to you, in whatever way you have the capacity to do it. The kinds of things you can do to be an advocate, well, they're almost innumerable, but some of the things we suggest include signing up for our newsletter and the DAPA newsletter. DAPA stands for Disability Advocacy and Policy Alliance. It's a collaboration of the council and various other advocacy organizations. We put out advocacy alerts. We put out our policy perspective. We put out our newsletters. So sign up for those things through our website. Make sure that you're talking with your family and friends about the issues that matter to you, people in your community, people in your faith community, wherever it's appropriate. We don't want you to, to do it in inappropriate ways, but wherever it's appropriate, help people to understand what matters to people with disabilities and how legislation, how state policy can affect those lives, whether for good or ill. As I said, contact your elected officials, but not just your elected officials. Contact people at Access, at DDD, at DES, at the Department of Health Services, at the governor's office. They are public servants. We are all public servants. And our job is to represent the needs of the public, so they need to hear what those needs are. And then if you have the opportunity, testify at the legislature. Based on the names I've seen on the call today, I think probably a lot of you already have done that at some point. It's not as intimidating as it might seem, and it's a great way for you to get to know your elected officials and for them to get to know you. Feel free. It's why we offer, or why the legislature offers committee hearings, why they offer the opportunity to testify, because they need to hear from the public. The last thing I would say is, when it comes to Medicaid, it is the foundation of DD services. We almost feel like we can't talk enough about the importance of Medicaid, and we hope that you will do the same. You will share your Medicaid stories. You will explain to policymakers why Medicaid matters and why it should be funded, and help them to understand the range of different things that Medicaid may fund in your life or in the lives of people you care about. It is a truly vast range, and often people have a limited view of what Medicaid is or who receives Medicaid. These slides will be made available to you. I think you're probably all familiar with the policy priorities of the council, most of which are things that I've talked about today. One of the things that, that we really are committed to is self-determination, self-advocacy, ensuring that the voices of people with disabilities are heard in the halls of power. And that, again, is not just elected officials, that's appointed policymakers as well. More and more, the voices of self-advocates need to be heard. And if you are a self-advocate, we hope you will take the opportunity to speak up whenever you can, wherever you can, about why disability services matter to you and how they can be made better. With that, I am going to finish, and I appreciate your patience and your willingness to stick with me through all this. Happy to answer any more questions that people have.
Well, thank you, Jon. All right, looking through the questions in the chat, we have another question about the backup plan for the national moratorium on DME.
Oh, yes. I'm sorry. My apologies for not addressing that. One of the things, as part of that announcement about cutting off the Medicaid funding to Minnesota, the CMS also said that it was putting a 6-month moratorium on any new providers of durable medical equipment and potentially pausing the availability of any new DME to individuals with disabilities who need it. Where this is coming from, well, again, the excuse of waste, fraud, and abuse was raised. There was the assertion that the DME world is filled with fraud, and so the federal government needs to stop funding it for 6 months in order to get a handle on where that fraud is originating and then root it out. Well, if you have mobility issues, if you have challenges that would require any form of durable medical equipment, a 6-month pause could literally cost you your life. And so what's the backup plan? I think at this point, because the community was taken so aback at the notion that they would put a 6-month pause on that, I'm not sure that there is a really coordinated backup plan. Now, states can fill the gap if they have the funds to do so. I would hope, and I haven't spoken with anybody at Access since I saw that announcement. I would hope that Access is taking some action to make sure that it doesn't leave anybody in the lurch. I don't know that for a fact, But I think what it's ultimately going to come down to for now, until this gets resolved, until the pause gets rescinded or whatever, it's probably going to fall to the states to make sure that people have the DME they need and are not left wanting. That I'm happy to do some more research and find out what else is being done on a more national level. I'm happy to talk with you more directly about it if you want to, but give me a day or two to try and find out who's taking action and what that action looks like.
Next question from Kristen. If the legislators are lacking knowledge about work requirements, how can we effectively educate them? I assume this is about the Medicaid work requirements.
Right. Well, I think the simplest way is to try and get an appointment with the people who represent you in your district. Once again, they're in the middle of the session, so it might be a little more challenging, but give it a try. If you can't get an appointment, talk to their staff, call them directly. Email seems like it would be a great way to do it because you can explain an entire situation. The problem is that at least during the session, they generally disregard a lot of the emails they get. It's not the most efficient or effective way of reaching people. But if you call their staff's responsibility is to log all the calls they get and to report on those calls to their bosses. So call, try and get an appointment. If you can't get an appointment, at least discuss with the staff member what the issue is, why it matters, and how you would like to see it addressed. I would also say, call the governor's office. Talk to somebody the governor has an advisor for Health and Human Services. The governor has an advisor the governor has an advisor for health. She has a separate advisor for human services. She has a number of people on staff whose job is to interact with the various human services agencies in the state. Share with them how you're feeling. Let them know what the issue is. And last but not least, talk to the people at the state agencies who oversee these programs, whether it's Access or DES, DDD probably, but it could be other agencies within DES. Communicate with whomever you can and let them know the impact. Here's what I will also say: those state level bills that relate to work requirements in our current environment are not likely to get signed into law. There are some fundamental disagreements between the party in power at the legislature and the party in power at the governor's office about work requirements. And so those bills, if they reach her, they're likely to get vetoed. At the federal level, however, they're already law. So the best we can do is make sure that the agencies that are required to implement those new provisions, which in this case is DES and Access, that they understand the realities of the situation and they are mindful of being as sensitive individuals' needs as they possibly can be.
We have one last question.
Okay.
Sorry, didn't mean to interrupt. Go ahead.
No, that's okay. I was just going to say, it may not be a satisfactory answer, and I apologize for that. But now that things are written into federal law, there's, they have to be implemented unless they're rescinded. And we just need to make sure that they are implemented in the most humane way they possibly can be.
Thank you for that. We have one last question. Are unvetted migrants eligible for Medicaid in Arizona?
No one who is in the country without proper documentation is eligible for Medicaid, is eligible to become a Medicaid member. Only citizens of the United States or people with the appropriate documentation to reside in the United States under certain circumstances are eligible for Medicaid. That is the law. There are a lot of misperceptions or misconceptions about that. Some people believe that just anybody can apply, but that is the law. Only U.S. citizens and legal U.S. residents can be Medicaid recipients. Now, that being said, there is federal statute that says that emergency rooms at hospitals must stabilize individuals who present in those emergency rooms with medical conditions. A lot of that care is provided through Medicaid funding, but those individuals may not be Medicaid members. It's just the Medicaid system paying for the care that is given to them. But once they are stabilized, the hospitals are under no further obligation to provide ongoing care and to, to build the Medicaid system for that ongoing care. They simply are required to stabilize them. So the shorter answer is no, no one in the country illegally can be a Medicaid recipient. The more nuanced answer is sometimes Medicaid funding does pay for care for people who are in the country illegally, but only under emergency circumstances.
Looks like that was the last question. Any final thoughts, Jon?
I guess I would repeat what I said earlier. If you have further questions, if you want to dive in at these issues or any other issues more deeply, please feel free to contact me. You can see my contact information on the screen. We will also make these slides available. We will post them on our website. And I don't know if we're going to email them out to everybody who registered for this event or not, but we're always happy to make this information available. I do want to say that I appreciate you being here. I do not pretend to be an expert on all of the facets of federal or state policy, but there are lots of other people I can point you to who can provide additional information if you need it. Just feel free to contact us and we'll get you what you need or get you to the person you need to speak to. Thank you very much for being here. Stay attuned to what's happening at the legislature. Stay in contact with your legislators and continue to be an advocate for good disability policy in the state of Arizona and across the nation.
Thank you, everybody, for joining us today. Just a quick reminder, we will be sending out a full recording of today via our email list. I've included that sign up link in the chat. We also plan to post the recording on our ADDPC YouTube channel by Monday afternoon. Most likely it will be this afternoon, but just providing a little bit of cushion there. We appreciate each and every one of you. Feel free to contact us. I'm available at saruf@azdes.gov. I'll put that in the chat as well in case you have any particular questions about today's presentation. And we will also email out the slides to everyone on our email list. Again, because we did not provide a registration link and form for today's presentation, our email list will be the best way to get these resources after the fact. Thank you, everyone. Thank you to our interpreters. We hope you have a great weekend. And I'm going ahead and wish you well. And I will stop the recording now.